Yeah, absolutely. So, as I get more and more involved in the advocacy realm of things, there are four key things that really the CHIME advocacy teams are focusing on at a national level. It's cybersecurity, interoperability, opioid epidemic, and telemedicine. All very relevant, and what's probably the most pressing in some cases is the opioid epidemic, because we don't necessarily hear about it as much. We hear about the things that we can do like EPCS and help our physicians get in front of that. But, I personally haven't been affected by anybody with opioids, but I know it's very prevalent. I mean, 70,000 people a year are dying from opioid overdoses. And it's not like the people you would expect. I'm surprised I don't know anybody, and I'm grateful that I haven't. And so when you think about things that you can advocate for, the Senate was actually voting this week on a bill that you can get fentanyl, which is 50 times stronger than heroin, mail order through China, through the U.S. Postal Service. And the Senate's voting on a bill to ask the USPS to have to register these packages that are coming in. It's something that FedEx and DHL and UPS already do. So you can at least get in front of the fact that you can mail order some of the strongest opioids out there in the world, and to figure out a way to get in front of that more than just through the HIT efforts. And so I'm grateful that we have such visibility into it at a national level. I feel like it's something that's not partisan. Whether it doesn't matter what your politics are, it's a problem. And you see people coming together at a time when they've been more divided than ever on helping people overcome an addiction and creating policy that allows for that to potentially be a true statement.
Yeah, I also noticed that in the bill it has it accelerates the research to develop non-addictive painkillers and alternatives to opioids, which is, I guess they call it really the silver bullet if you can get a non-addictive painkiller. And so that's a great step as well. All right, so that's a regulatory step that's being taken, and we appreciate that. It's interesting, when I had Ann Weiler on the show, the CEO from Wellpepper, which is a digital startup, she discussed how HCAHPS is a potential driver for overprescribing. So HCAHPS has a score, as you know, of how was your pain managed, and she shared the story. So when someone's prescribed opioids after total joint replacement surgery, they're typically prescribed a large number because you can only prescribe them in person. And so if they're having joint replacement, they can't get back into they struggle to get back in to get the prescription refilled. So they overprescribe. And then so two things happen: either they take them all, or it ends up in a medicine cabinet for a high school kid or younger to take. And she actually shared a patient story. They were doing some research, and one of the patient stories, a good patient said, well, I took all the opioids. And they said, well, was it because of your pain? And the answer was, no, it wasn't because of my pain. It's because my doctor prescribed it to me. I assumed I was supposed to take it.